preview. Today I'm going to show you an opioid-free technique for treating migraines that don't respond to traditional therapy. If you want to skip to the procedure, it starts at about the 2-minute mark. Background. We see a lot of migraines in the ER, and we're not going to talk about standard treatment today. There are many great drugs out there that work almost all of the time. But every so often we have a patient who doesn't respond to traditional therapies and still complains of severe pain. What do we do? You could go to opioids next. They can work, but they can also make headaches more frequent in the long run. We're also in the middle of a huge addiction epidemic that's killing thousands of people. Some patients may be Malign-graine, but we really can't tell which ones. We need to find a fast, single treatment pathway that falls between the extremes of letting people suffer and casually handing out opioids and contributing to a massive public health problem. Because it's so easy to type in a Dilaudid order. Dilaudid works for me.
The other doctor gave me Dilaudid.
The nurses prefer it, the patients like it, and it's less work for you.
Would you like to give Dilaudid, doctor?
Everything is pushing you to make the wrong decision. When a patient fails traditional therapy, think about nerve blocks instead of narcotics as your next step. Your goal should be to make it short and quick. There's all kinds of nerve blocks out there, but if it takes you more than 2 minutes, you're just never going to do it. Procedure. First, I do a greater occipital nerve block. The nerve is just medial to the occipital artery. You can Doppler it or you can palpate it in patients with short hair. One landmark method is to imagine a point directly opposite the inferior orbital foramen on the anterior portion of the skull. You can also use the inion, the greater occipital protuberance, as a landmark and go about 3 centimeters laterally and a little bit inferiorly, just inferior to the nuchal ridge on the skull, right where the soft tissue starts to get a little bit thicker. Draw up your local anesthetic of choice, I prefer bupivacaine, and warm it up a bit if you can. Advance your 27 gauge needle at the proper location, angling it superiorly, that's important, until you touch bone. Then aspirate and inject about 2 mLs, then withdraw your needle a bit, aspirate again, and inject another 2 mLs into the soft tissue of the scalp. You can fan it around if you want. This will anesthetize this region of the cranium. Now we're going to the lesser occipital nerve. If you measure from the occipital protuberance to the mastoid process, the lesser occipital nerve is about 2/3 of the way across. Inject again the same way. Cleanse the skin, insert needle, touch bone, aspirate, inject 2 mLs, withdraw, aspirate again, inject 2 mLs. This will expand your region of cranial anesthesia. Lastly, we're going to inject a branch of the auriculotemporal nerve, which runs just posterior to the temporal artery, so you can use that pulse as a landmark. The best place to go is just anterior of where the pinna meets the scalp. Then inject a few mLs of your local anesthetic and withdraw. This will anesthetize the region shown here, and with all 3 blocks, you've anesthetized a good portion of the cranium. You don't have to do it this way every time. You can mix and match your blocks depending on where the patient's headache is. You can do bilateral blocks, supraorbital blocks, paracervical blocks. You can give them nebulized lidocaine while you do it. Whatever you choose, get it done quickly and then leave. After a few minutes, your patient will either say, "I feel better," and won't need opioids, or they'll say, "I feel no different," in which case you might want to finally consider using opioids. At least you've made a genuine effort to avoid exposing a migraine patient to opioids. And you've also done right by your malingering patient too, although they probably won't be very happy with you. That's okay, because remember, part of our job is to not harm people, even when they want us to.